Before using the technique, I don't think I had near the appreciation for soft tissue dysfunction because I really wasn't feeling the subtleties of more of the subtle soft tissue lesions.
You can actually get deeper into the tissue, and so you're actually feeling all of the different micro damages that have been done.
Now I'm finding much more dysfunction than I could pick up with my hands alone. And so once I find those more subtle lesions in the soft tissue, I can more specifically treat those lesions, and it's a much more effective technique for the patient.
When I first started the technique, I started practicing on my staff, and one of my staff members, she was newer to my office, and she'd been a patient previously. And as I started doing the technique, she reported that she had had a foot condition. She had gotten a surgical opinion that she was going to have basically her foot broken, and she was going to have a lot of reconstructive work, and she was going to have to be in a cast for several weeks. She got phenomenal results to the point that she's never had surgery.
Early on, when I first started using the technique, we had a physician suffering from tennis elbow, and he had undergone more traditional conservative therapies, your typical manual friction massage, phonophoresis, stretching, what have you, and just wasn't getting relief. And he was unable to play golf, which was something that was very important to him. We used the technique on his forearm. We're able to identify more of the subtle lesions in his wrist flexors, for example, and he was able to return to golf after about a month of this treatment, where he had been suffering from this condition for several years. He liked the technique so much that he is one of our biggest referral sources now and sends us a lot of his patients after seeing the benefits and the success with this technique.
The athletes love it because they can tell the difference once they get so far into treatment. When you first start, they say they feel like ripples going down. When you get further into the treatment, about 3 or 4 in, they're like, I don't feel ripples anymore. Therefore, it's getting smooth and the tissue's starting to realign.
If I can get this much result with a case that was so far gone as hers, then think of what I could do with other cases.